Recreational marijuana has been legal in Colorado for almost 3 years now.
And hospital policy.
Public health officials question people who say the sky didn't fall.
I would say by whose standards did the sky not fall? And it's really important, especially with marijuana, to consider how long it takes the sky to fall.
Ben Court is an administrator at CEDAR, the Center for Dependency, Addiction, and Rehabilitation at the University of Colorado Hospital in Aurora.
There's a lot more happening out here than what the headlines say.
For years, Colorado has been above the national average when it comes to marijuana use. State data show teen use has been flat since legalization, but Court points to national data showing that the Centennial State is #1 in marijuana consumption across every age group. A big difference between what's happened here in Colorado and what could happen in Maine has to do with amount. Here in Colorado, you're only allowed to buy, and I'm only allowed to physically hold, 1 ounce of marijuana. Now, if this ballot question passes in Maine in November, it means adults will be able to buy 2.5 times that, 2.5 ounces of pot. Public health officials also warn of the increasing potency of cannabis products. This is not Woodstock weed.
I can't hit all that.
Naturally occurring inside of cannabis is between 0.2 and 0.5% THC. We're talking about THC above 40% and then above 90% with concentrates. That's not natural, and it's not good for the brain and body.
That's raising a lot of questions for the doctors who work with Court at CEDAR. Dr. Michael Barnes is the clinical program manager.
It's like a big science experiment. We don't know what's going to happen with long-term, very high levels of THC use.
Dr. Barnes says pot has always been a significant part of the drug catalog among his younger patients, but lately he says he's been seeing more and more patients with psychotic symptoms, raising this question.
Is this a thought disorder or is this a drug-induced psychosis?
High potency.
Dr. Laura Martin is an addiction psychiatrist and CEDAR's medical director.
I think that the jury's still out for the lessons that we have, and we certainly don't have the lessons that we're going to learn in 10 years related to the number of individuals who may develop other drug use disorders because they're using marijuana now.
While some people argue that the availability of legal cannabis means fewer people will turn to harder drugs like opioids, the people at CEDAR say marijuana is a gateway drug to more serious substances.
Not everybody is thinking about the long game with this.
Court says the problem with trying to get his message out there is that there's no money in prevention, and people would rather listen to celebrities than public health officials.
Willie Nelson has a different message than I do.
This is all about the commercialization of THC.
Public health officials aren't the only people pushing back against legal weed. We'll tell you more about that tomorrow. In Colorado, Paul Merrill, WMTW News 8.